I would like to delve into starting with, if you can briefly talk about your background, the organization, and your initial takes on the paper.
Okay. Hi everyone. I'd like to begin by acknowledging the traditional owners of the lands on which we meet and pay respects to elders past, present and emerging, and any First Nations people that may be with us this afternoon. It's a real pleasure to be with you. I'm the current CEO of Fronditha Care, which has a 46-year legacy of providing aged care services predominantly to the Greek community. I had the privilege of being the first female president of the organisation, so I understood the organisation from a governance strategic perspective. And since 2021, have had the privilege of being its CEO. Fronditha Care provides services across the spectrum, beginning with community services, so in-home support, planned activity groups, through to respite and residential services. We provide support to over 1,800 now elders in the community. When I joined the organisation as CEO, we sat at around 600 staff. We've grown that to 800 staff at a time when, I think workforce challenges are experienced across the board, especially in social services. We have over 200 volunteers and over 200 members. The organisation has transformed itself in the last 2.5 years. When I came in, we were facing losses of over $10 million and a global pandemic. I'm really pleased to say that last year we posted a profit and we'll post a profit again this year, all while improving our governance framework, our IT infrastructure, the way that we work as one Fronditha to ensure that the service that we provide to our elders is seamless and absolutely person-centred, and that speaks to their cultural, spiritual and physical needs. And it responds to the way that they want to age and how they want to age, be it in place or whether they need more permanent care in residential services. I guess the interesting thing about our organisation is that while we grew out of a understanding a need of community to respond to those who were without means and needed care, we've never lost sight of our purpose and our mission. And I think that the success that we've had in the last 2 years, despite all the challenges and how we've weathered the storm, is that we are very focused on one thing, and that is people. And by people, I mean not only the people in our organisation that work for us, who are the backbone of everything we do, but the people that we have the privilege to care for.
Could you, before I go to the next panelist, could you give us your few initial takes on the paper?
On the paper, yeah.
Yeah.
So I thought the paper, my background is in, I've worked in public policy at state government level, Victorian government, also worked in corporate advertising, social research, social marketing, and worked for a very long time as a strategist. So I actually applaud the government for developing a strategy that is forward-thinking in terms of looking for solutions, policy solution and service implementation that takes a holistic view. And that whilst it's a beginning of a conversation, I believe there's work to do in terms of providing greater clarity around what the care economy is, but what care, if you take it back a step, what care actually means to individuals, what it means across the different sectors, and what it means, because the 3 pillars that the strategy talks to are all important and they're transferable across social services sectors. But I think it's ambitious in what it's trying to achieve, the strategy, which is an integration of social services. And I think that it's commendable, as I said, but there's a long way to go in terms of bringing all that together under the plans that the strategy talks to. And I do think that one of the things, and I'm hoping that we'll get to speak about these, but in more detail, one of the things that for me was potentially an opportunity was to do a mapping of what, like I said, the current care system is like, not from a policy perspective and not from a political perspective or service infrastructure perspective, but from a community perspective of service recipients.
Thanks a lot.